Hi, I'm Hope Witkowski, your host of Senior Scene. Did you know that falls are the leading cause of broken bones and injuries leading us to go into the hospital? According to the National Council on Aging, 1 in 4 seniors aged 65 and over fall every year. On today's show, we're going to meet some seniors who've taken falls and learn secrets on how we can prevent those falls. The Torrance Fire Department tells us that 911 calls come in every day to aid a senior who's taken a fall, and some pass out, break bones, and some even can't speak. And they say one of the most common places in the home for accidents is in the bathroom.
One thing to think about when seniors are in the bathroom, let's say a shower or bath, and they stand up from the bath, they really need to give themselves a moment to allow their body to adjust from the sitting to the standing position, because physiologically there's changes going on in just that short time span. So they give themselves time to adjust and then step out of the shower. We've all stood up and been lightheaded because we stood up too quickly. This can theoretically happen more in certain age groups.
A very important thing that needs to be done so that the paramedics can enter the home in a timely manner is to make sure seniors have all elements in place, and this will allow the first responders to enter quickly.
Typically, when we get a call, either the patient or a neighbor or a family member is called, and sometimes it's because they haven't been in communication with the resident or the patient. Occasionally, our residents have a medical alert alarm that they wear, so if they do fall or have any medical issues, they can push that alarm, and we are alerted through our dispatch to respond on that resident. There has been occasion where we show up and we don't have access because we don't have a key, or there's no neighbor or manager of the apartment complex to let us in. So we always can get in. Sometimes we may have to do some damage to do it, but when it comes to life safety, we'll have to do what we're going to do to make sure we make entry. When we do get in, on occasion, we have found patients that have been there on the floor overnight because they didn't have any way to communicate, to get help coming, and we were alerted through a family member that wasn't able to get in contact with them.
Having all your medical history in place for the first responders is really a life-saving thing to supply. The emergency team is making guesses on what condition of health the senior is in and must start from scratch.
When we arrive on scene and assess a patient, they're unable to communicate with us, and we have no information about that patient, we always investigate in the immediate area to see if they have any identification or a lot of times people will have their medications nearby. So that'll give us their name, that'll give us a general medical history, and then we're always going to take the patient to the hospital and treat them depending on their injuries or medical condition. When we arrive at the hospital, we let them know what we found.
Our concierge doctor gives us a look at what happens to adults as they pass their 65th birthday. What causes these falls and their balance problems? Her field as a geriatrician is to help this age group through the aging process, giving them the information on how to prevent these falls.
When you come to a geriatrician, you're going to be getting a comprehensive geriatric assessment. This basically means that we go over all different aspects of your health, not just medical, but psychosocial, biological. We do a comprehensive review of your medications, and we really look at you in the setting of a whole person as opposed to just a medical problem.
Dr. Lauren sees patients of all ages and says it's not about the age, but how they have taken care of themselves.
Age is just a number. We truly believe that here. I emphatically believe that. You can see a 55-year-old who is as frail and as sick as a 95-year-old, and you can see a 95-year-old who's as healthy and vibrant as a 55-year-old. So physiologic age is really the basis of how I categorize patients as opposed to just their chronological age.
We all want to age successfully, but what are the secrets that we should know and then start living the instructions that our doctors tell us to do?
As you age, there's a couple of or several diseases that happen to the eyes that are going to increase your risk of vision impairment, which impair your gait and balance, because you use your vision to see where you are in space. And you can test this on yourself. If you close your eyes and lift one leg up, you lose your balance. And that's because you need more than one sense to keep your balance right. So things like macular degeneration, glaucoma.
And by sharing their health history with their doctors, they can better help access what is going on, especially when things may not be working as well as when they were younger.
Cranial nerve 8 is responsible not just for hearing, but also for your balance. So hair cells actually also tell you where you are in space. So they're little nerves that are present that can tell you where you are in space, and you also have little rocks in your ears. We call them otoliths. And otoliths sit in fluid within your ear canal, in the inner ear, and they let your body know where you are in space. If those become dislodged for any reason, or fibrosed, the ear canal, as it often does with age, you will not feel as confident of where you are in space.
Dr. Lawrence has one amazing 98-year-old patient that is as sharp as a tack and in great physical shape, but has taken several falls that has led to broken bones.
In Dorothy's case, there's a few things you need to consider. She does have hearing impairment. She does have vision impairment. As you age, the one thing I didn't get a chance to say is about the proprioception. So I often call this the sixth sense. And it's the ability to know where your limbs are in space. And you have peripheral nerves that do that. So nerves in your feet primarily, as well as in your hands. They're nerves that can tell you, my foot's to my right and on the ground. My foot's to my left and on the ground. As you age, those you get some vascular disease and the blood supply to those nerves decrease, and you get almost little strokes to the nerve. And you're going to have less of an input to your brain about where you are in space. Diseases in and of themselves, like diabetes, are going to make that worse. Vitamin B12 deficiency is going to make that worse. So there's a variety of medical conditions that affect the nerves that then affect your ability to maintain balance.
Dorothy could be a role model for many of us seniors. Her life story for a 98-year-old could be told in a book. When meeting her, you might be surprised at how active she is.
The war started that year, or we got involved in it that year, and I had a job in the civilian arm of the Air Corps. It was called an occupational analyst. I did that for a year and drove all over different air bases in Northern California, and I met the man who eventually became my husband. But he was a pilot, shot down during the war. He was a POW, and we married after the war, obviously.
Dr. Lawrence applauds the life that Dorothy is living and how she is still so engaged in the outside world. She wants to remind us that when a doctor tells their patient to be careful when they are moving around in this world, that they take it seriously. She understands the negative stigma that a senior might find by using a walker or a cane.
There's a couple of issues that I think lead to falls unnecessarily more commonly than anything else. One of them is pride. So for reasons that are unclear to me after I've seen all of the devastation that falls can do, people do not want to use walkers and canes. They're life-saving in many situations and absolutely need to be used so that people can keep moving. The worst thing you can do for yourself if you need a walker or cane is not just not use one, but stop moving, which is often what happens because you're afraid to move, because you're afraid of falling. If I had a magic wand, I would absolutely, I would tell people that you need to put your pride aside and intrinsically have the self-esteem to know your worth, to, you know, move forward despite what other people are saying about you or thinking. That's what I try to instill in my kids, and I try to instill it in my patients too. What a lot of my patients don't know, but I know because I've been a physician and seen this, is that, you know, having a fall and getting an injury from it often results in a fate worse than death, which is permanent nursing home placement. You're no longer able to care for yourself. And so I try to put a healthy fear of falling into my patients, which is, listen, you need a walker. If you have a walker, you're not going to fall, or you're less likely to fall.
Another patient of Dr. Lawrence is John. He also took a few painful falls recently, and you might be surprised to find out why.
There's a cascading event in medication prescription, which is that I prescribe you a medication for your diabetes, and then this medication causes nausea. So then I prescribe a medication for your nausea, and the medication for your nausea causes you to be constipated. So then I prescribe you a medication for that. And then it's this whole drug cascade where if I had just changed the diabetes medication to begin with, for which you were having side effects, the entire, you know, polypharmacy issue could be eliminated, thus reducing your risk for falls. So I wouldn't say, you know, every medicine isn't needed, and one of the biggest problems seniors have is that they are looked at as a list of diseases. I can't say that enough. They have heart disease, kidney disease, diabetes, high blood pressure, and that becomes them. It becomes their list. And then a medicine is matched to each of those diseases, when in reality, they're a whole person that lives in a certain environment with certain limitations, and if you don't consider those, you are doing them harm.
It was his medication that were interacting with each other, causing his serious life and death events. It happened when he was having a procedure done at the hospital.
I wasn't beating fast enough. It was down into the 40s and got even down into the 30s. It was irregular, and several times I actually died for 3 or 4 seconds. Wow. In fact, when I was waiting to have it done, I died for 6 seconds. The nurse ran in and says, "You just died for 6 seconds." So it was very serious.
John now boasts about the different types of walking assistance tools he now owns. He loves the freedom he's getting around, and he has no worries about what people think of him as he's using them.
I have different kind of walkers, not just the one. For instance, in the house itself, I have a wheelchair, and I fold it together, and I use that to go around my house with that, because it has 4 wheels to it, gives me good balance, and I also put something in between there if I want to carry it around. And then when I go outside, I have a 3-wheeler when I go shopping or get out of the car. And then I have another one with 4-wheelers, 2 of those. So it's...
The 4-wheelers are walkers?
Yes, they have a seat in them.
Oh, they have a seat.
And that's the one I use when I go to the park to feed the squirrels, because then I can go and sit down. And I usually, in a case like that, I usually try to walk a mile in the park. And that way I'm able to sit down, and the squirrels know me now.
Dr. Lawrence informs us about the different ways we can improve our stamina and balance as we age. It was fun for me to spend some time with the 98-year-old Dorothy as she gave us a look at some of the types of exercises she does at home and also when she goes to the gym.
A study came out that looked at what the best exercise was for aging muscles. And they compared normal exercise, which would be endurance, to weightlifting, to something called high-intensity interval training. High-intensity interval training is where you work very hard for a period of 3 minutes, you rest for 3 minutes, and you alternate it with working hard and resting. And this can be riding your bike, working hard in the pool, running, depending on what your physical limitations are. It actually changes the DNA within an older person's cells when they do this kind of exercise. the high intensity interval training. It is such an amazing thing that we have this science, that to know that when I recommend to my patients that they do the high intensity interval training, they are literally changing their cells to be stronger, younger, more durable. So with this study, new recommendations are being made about how older people should be exercising to really optimize their muscle health.
The combination of too many medications and the way that a person with a medical condition gets up out of bed could also be a factor behind falls. Dr. Lawrence gives us information on a better way of getting up.
When you're getting out of bed. Yes. So like John would be a case of this, where he went from laying to sitting to standing. He became lightheaded. Oh. And so when you're getting out of bed, you're going to crumble there. So having your walker right next to the bed, or having, drinking a glass of water before you get up, making modifications within your home so that the environment is optimized. And as a society, we need to do better with making sure